Thank you, Madam Chair, Chairwoman Maloney, Ranking Member Comer, Congresswoman Kelly, and to other distinguished colleagues serving on the Oversight Committee. Thank you for the opportunity to join you today for this historic hearing in the House Oversight Committee on maternal mortality and the disparate and unacceptable outcomes that Black women and birthing persons face. As a founder and co-chair of the Black Maternal Health Caucus, I want to just take time to speak about the Black maternal health crisis in America, where Black mamas are disproportionately and needlessly dying. The U.S. is one of 13 countries in the world where the rate of maternal mortality is worse than it was 25 years ago. And even more disturbing is that across the country, Black women from all walks of life, regardless of socioeconomic status and education, are dying from preventable pregnancy-related complications at 3 to 4 times the rate of non-Hispanic white women. And the shocking fact is that 60% of maternal deaths are preventable. Research also suggests that the cumulative stress of racism and sexism undermines Black women's health, making them more vulnerable to complications that endanger their lives and the lives of their infants. Unfortunately, current healthcare practices are insufficient in addressing the health consequences of living with this stress. In fact, the healthcare system often fails Black women, providing inadequate and culturally insensitive care that's plagued by bias, racism, and discrimination. This crisis demands urgent attention and serious action to save the lives of Black mothers and women of color and other marginalized women across the country. Which is why Congresswoman Underwood and I crafted and introduced a comprehensive package of 9 bills called the Black Maternal Health Omnibus Act. And this February, we reintroduced an updated package of 12 bills with Senator Cory Booker. You know, the Omnibus will comprehensively address every dimension of the maternal health crisis in America to save lives and end racial and ethnic disparities in maternal health outcomes. The bill makes investments in social determinants of health, increasing maternal vaccinations, improving our national response to pandemics with respect to maternity care, the growth and the diversification of the perinatal workforce, improvements in data collection and quality measures, digital tools like telehealth, and innovative payment models. It focuses on environmental justice because recent studies have reinforced the linkage between man-made climate change and the toll that it takes on pregnant women and their infants. And very importantly, the Omnibus provides critical funding for community-based organizations, perinatal workers, doulas, and midwives, and lactation consultants who are doing the work right now to save Black mamas and babies, especially in communities of color. We know the solutions that our communities need, and I'm fighting hard every day in Congress to speak up and stand up to make sure that my colleagues understand what Black women need and what they must have. The Omnibus is a bold and compassionate solution to that unequivocally says Black mamas matter. That's why I'm calling today for the Omnibus to be included in the American Families Plan, which is a once in a generation investment in healthcare and education and childcare. The inclusion of the Omnibus would build on Biden's administration American Rescue Plan, a bold and compassionate relief bill that included a provision to extend Medicaid coverage for up to 12 months. In 1962, Malcolm X said that the most disrespected person in America is the Black woman. The most unprotected person in America is the Black woman. The most neglected person in America is the Black woman. Sadly, that continues to be true and evident in the health and economic outcomes that we continue to face. The pandemic has revealed these disparities all too well, and it has further exacerbated them. In 1966, Martin Luther King declared of all of the forms of inequality and injustice in healthcare is the most shocking and most inhumane. Including the Omnibus and the American Families Plan is a key way to address long-standing health injustices and to ensure that our moms and our babies have the resources they need to not only survive, but to thrive. It doesn't matter what side of the aisle you're on. Either you have a mother, or you are a mother, or you know women who are moms. When we raise the tide for Black women who are among the most marginalized and the most vulnerable, we ultimately raise the tide for all women. All moms deserve equal access to quality maternal care without bias. Passing the momnibus, we can begin to take action now to truly hold ourselves, our health systems, and our society accountable. I urge my colleagues to support the momnibus. Our Black women and our mamas deserve better. I yield back, Madam Chair. Thank you so very, very much.